In this lecture, I'm going to cover the skeletal elements of the mandible and the thoracic cage, as well as the pectoral girdle bones. And here on slide 26, when we take a look at the mandible is characterized by a number of unique anatomical and structural features. And the first feature I want to highlight here is the TMJ, or the temporomandibular joint, that is named according to the two bones that form this articulation. And those two bones, of course, is the temporal bone and the mandible. And we see that articulation right here, where the temporal bone has what's called a fossa, which is a depression in a bone. It's a concave depression through which the mandibular condyle, and I'll define that here in a moment, articulates with that temporal bone. And this bone here will rotate inside this fossa, or the condyle will rotate inside the fossa, and that's what allows the mandible or the jaw to open the mouth. We see a mandibular notch, which is a much greater concavity or depression here in the mandible. And the mandibular condyle is a typical rounded prominence, typically that is found at the ends of bones, and we'll see that in some of the other bones in the upper and lower extremity. And so this is a bilateral condyle. The temporal bone is not illustrated on this particular condyle, but it is here on the left condyle. The ramus of the mandible refers to this very large border on the inferior side of the bone that forms a unique angle into what is called the body of the mandible, or the most inferior part of this bone. Moving on to the thoracic cage and the pectoral girdle. The thoracic cage is so named because the bones forms essentially a cage made up of the thoracic vertebrae, primarily the thoracic vertebrae, as the view is obstructed by the sternum, which is another important part of the thoracic cage, and of course the ribs. And the thoracic cage provides a very important site of attachment for various muscles, and also serves as a very important protection mechanism for internal organs found inside the thoracic cavity, namely the heart and the lungs. But if we take a look at the major bony components, I'm going to start right in the center with the sternum. And the three major parts of the sternum include the most superior part, which is the manubrium, moving into the main portion, which is called the body, and the very small bony prominence called the xiphoid process. On the left-hand side of this image, we see that the pectoral girdle is a connection between the clavicle, which is our collarbone, and the scapula, which is our shoulder blade. The thoracic cage is also made up of the ribs, through which the first 7 ribs, 1, 2, 3, down to 7, are called the true ribs. They're termed the true ribs because these ribs will have a costal cartilage. The blue indicates this is cartilage that connects the ribs directly to the sternum for ribs 1 through 7, which is why they are referred to as true ribs. The lower ribs, 8 through 12, are referred to as false ribs, which are ribs that do not have a direct connection to the sternum. The lower 2 ribs of the false ribs, 11 and 12, as you can see here on this picture, are called the floating ribs because you can see here the floating ribs, although they do have a cartilage portion at the very end, these do not have a direct or even an indirect, do not even have an indirect attachment to the sternum. False ribs 8 through 10 do have connections to the sternum, but those are indirect. It's not direct as we see with true ribs 1, 2, 7. In terms of the shoulder joint is a joint formed by a number of bones here. And the first bone to make note of is the clavicle or our collarbone. So the clavicle articulates with the manubrium portion of the sternum on the medial side, and on the lateral side forms a connection with the scapula, as you can see here. So here we have what's called the medial or the sternal end, which is commonly used to refer to this end of the clavicle, but one way to remember this is on the medial side, or the side that articulates with the sternum, and the scapula will form a connection to the clavicle at the acromial end of the clavicle. The glenohumeral joint, as you can see here that is circled, is a joint that's formed by the humerus, which is the bone of the upper arm, and the scapula in what's called the glenoid fossa, and we'll see that here on the next slide. The connection between the clavicle and the scapula, specifically the acromion of the scapula, and this can be palpated over the surface of a person's shoulder. It's a very bony prominence. That is called the AC, or acromioclavicular joint. And the joint formed by the clavicle and the sternum, or the manubrium portion of the sternum, is just simply referred to as the SC, or the sternoclavicular joint. Now, what we see here is another joint that is referred to as the coracoclavicular joint. So, formed between the coracoid process of the sternum, of the clavicle, of the scapula, and the clavicle. But these two bones are not in direct contact. There is a ligament that connects these two bones. Taking an anterior view of the scapula, what we see here is that very lateral bony prominence called the acromion that can be clearly palpated on the lateral side of a person's shoulder. The coracoid process is this oddly shaped bony prominence here that will serve as a site of attachments for ligaments and muscles. On the anterior side of the scapula is a very large groove, if you will, a depression called the subscapular fossa. The glenoid cavity is this depression, this concavity, this concave portion of the lateral portion of the scapula that forms a connection with the proximal part of the humerus of the arm, or the bone of the upper arm. And this connection between the humerus and the glenoid cavity forms the glenohumeral joint. Two more landmarks of the scapula are the medial border and the lateral border. So the medial border, so named because it's the long portion, edge of the scapula on the medial side of the body closer to the spine, and the lateral border, so named because it is located further away from the midline of the body or the spine. If we take a look at the scapula from the posterior side, we still see the coracoid process, but the coracoid process projects in a more anterior direction, but it is still viewable from the posterior side. We see the most lateral bony prominence of the scapula, called the acromion. And once again here, to landmark this bone, we have that very long lateral ridge referred to as the lateral border, and of course the medial border is so named because it is that side of the scapula that's closer to the midline of the body or the spine. The spine of the scapula is this very long bony outgrowth that eventually terminates into the prominence on the lateral side called the acromion, and the spine of the scapula serves as a distinctive separation between muscles that are attached to the scapula. One particular muscle is attached inside what's called the supra or above spinous fossa. So here we see a depression in the scapula, and we have a muscle that sits inside this depression. And if we have a supraspinous fossa, we have one that is below the spine of the scapula, and that sits inside the infraspinous fossa. So we have a muscle that's sitting inside this depression in the posterior side of the scapula. So this ends this video here on the skeletal components of the lower jaw and the thoracic cage and pectoral girdle.